All right. Well, good evening, everyone, and thanks for joining our men's health webinar. We're so excited to have the opportunity to share important men's health education with this group tonight. My name is Brittany, and I am the host of tonight's event. I'll start with a couple of housekeeping items, and then I'll introduce our speaker. Most importantly, your participation is completely anonymous to other attendees. No one can see your face or your name, and any questions that you ask can only be seen by myself and the speaker. We do encourage interactive presentations, so if you'd like to ask a question, just type it in the chat box at the lower part of your screen, and then we'll save time at the end of the presentation to answer as many questions as we can. Tonight's webinar will be presented by Dr. L. Andrew Evans, a prosthetic urologist and men's health specialist at Baptist Health in Paducah. Dr. Evans, I know your time is in high demand, so I thank you for your willingness to be with us this evening to share important education with the community. I'll turn it over to you.
All right. Thank you, Brittany. Good evening, everyone. Thank you for joining us this evening. I am Dr. Andrew Evans, and I'm a urologist with Baptist Health in Paducah. And I appreciate everyone tuning in to have an important discussion regarding men's health, including the very important topic of erectile dysfunction and male stress urinary incontinence. I would encourage everyone, while we're going through the slides tonight, to feel free to type in your questions in the chat. So we will leave time at the end for some questions and discussion. And if so, you don't have to wait till the end. Go ahead and type those questions in as you think of them during our talk this evening. I've also listed my website, wkymenshealth.com. It's a great resource. It has our office information, phone number, etc. Also some archived videos that I've done previously, and some good frequently asked questions in addition to the talk tonight. So feel free to use that as a resource.
Did you see that, Doctor?
I'm sorry?
Someone put that they couldn't hear anything.
I can hear. I'll message this individual.
Okay, I could hear too. Thank you.
I'm gonna get All right, so a little bit about me. I'm originally from Fayetteville, Arkansas. I did my medical training at Wake Forest, and I did all my urology training in the military in San Antonio, and served on active duty in the Army as a urologist for 14 years. I finished up my active duty service at Fort Campbell and ended up staying in Western Kentucky and going into the reserves, and been in Paducah 5.5 years, and I retired out of the reserves a couple of years ago. My main focus is on erectile dysfunction, and I do penile implants to treat ED, as well as I treat male stress urinary incontinence. Again, I've listed my website and all of our contact information here, and my office has been instructed to allow you to call and get an in-person consultation with me. Just please mention that you saw my webinar or heard my webinar, and they will get you an appointment with me with no referral required. So go ahead and feel free to call, and we can get you an appointment in to get you in a personal consultation. First of all, erectile dysfunction, otherwise known as ED, is defined as the persistent inability to achieve or maintain an erection that is firm enough to perform sexual intercourse. ED is very common. We estimate that nearly 30 million men suffer from erectile dysfunction in America, and that approximately 1 in 4 men overall have some form of ED. And as a man gets over the age of 40, half of men are estimated to suffer from ED in that age range. So it's extremely common. However, even though it's commonly associated with aging, it is not a normal part of aging. It's important to not suffer in silence and to seek treatment if you're having those symptoms. Before we talk about erectile dysfunction, we need to understand how a normal erection occurs. The brain, the nerves, and the blood vessels all work together during sexual excitement to produce a rapid inflow of blood to two spongy chambers that run down the shaft of the penis called the corpora cavernosa. And those corpora expand as blood vessels dilate, and the blood going into those chambers actually compress veins to keep the blood in the penis to maintain the erection. So you can have trouble both with inflow of blood to the penis, and you can also have trouble with what we call venous leak, or where the blood flows out of the penis. Erectile dysfunction has a myriad of causes, and it's usually not just one problem causing the ED. It's usually a multifactorial process where it's a combination of factors at work, including aging, smoking, chronic medical conditions such as diabetes or high blood pressure, high cholesterol, cardiovascular disease, etc. It's also very, very important to recognize that ED has several psychological effects. And men that suffer from ED have problems with anxiety, depression, low self-esteem, loss of confidence, overall decreased quality of life, and that men with ED tend to withdraw emotionally and physically from their partners. And it really can impact the couple, not just the man. I mentioned the link between erectile dysfunction and diabetes. We know that half of men with diabetes have trouble with ED, and we know that men with ED respond less to treatments, especially oral medications don't work as well in men that have diabetes. It's also very important to recognize that ED has a very important link with heart disease because, in fact, ED can be a very early marker for cardiovascular disease. The arteries going to the penis are some of the smallest in the body, and they're even smaller than the heart arteries. And so if you are suffering from erectile dysfunction, it can be a sign of that same plaque that can occur in the heart arteries can occur in the penile arteries. And so it's important to see your primary care physician to get your heart checked out and overall health, cardiovascular health risk assessment done if you are having ED problems. There are several ways you can reduce your risk for ED, including eating well, having a healthy level of physical activity. Weight loss can be very beneficial. Smoking cessation and limiting alcohol and drug use is also important, along with managing stress levels. Although prostate cancer in and of itself does not cause ED, several of the treatments for prostate cancer can affect erectile function. The nerves that control erections run right alongside the prostate, and so any treatment for prostate cancer can affect those nerves. When we remove the prostate, or what's known as a radical prostatectomy, we oftentimes do a nerve sparing procedure where we can lay those nerves to the side, but sometimes the cancer involves the nerves. Sometimes we can only spare on one side or the other. And with increasing age, sometimes those nerves are stunned a little bit more after surgery and require additional rehab process in terms of different treatments to reinvigorate those nerves and the blood flow. Even with radiation, external beam radiation, those nerves and the blood vessels that they control receive some of that radiation, and men who even get radiation therapy or other pelvic surgeries, such as treatment for rectal cancer, et cetera, can have ED side effects from that treatment. In fact, 25 to 75% of men who have a nerve-sparing radical prostatectomy do experience some level of ED afterward. We have very good technologies for treating prostate cancer, but it's important to know that if you are a prostate cancer survivor, there's several quality of life issues that follow after the cancer is treated, including urinary function, which we'll talk about here in a little bit, along with sexual function. Another huge men's health issue that I'll touch upon this evening is Peyronie's disease, and that's a big men's health issue. It's named after a French physician many centuries ago that diagnosed this problem in King Louis XIV. And Peyronie's disease is a chronic medical condition affecting the penis where we think due to chronic buckling trauma and buckling forces over time that the body lays down collagen and some scar tissue on the outside of those corpora cavernosa we talked about earlier. And that scar tissue leads to several things, oftentimes curvature of the penis and loss of penile length and girth over time, as well as worsening erectile dysfunction over time. And so it's even if the penis straightens out and the curvature kind of resolves, a man with Peyronie's is oftentimes left with shrinkage and worsening ED that becomes refractory to medications and treatments a little sooner. So we'll talk about that as well. I also want to mention this resource in addition to my website. There's another great website, edcure.com, or you can scan this QR code. Has a good video series and talk about how to fighting and solving ED, and a lot of good information there in addition to what we'll talk about this evening. I'd also like to define stress urinary incontinence. When we talk about urinary incontinence, that's involuntary loss of urine. When we talk about male bladder leakage, we're oftentimes talking about stress incontinence, and that's leakage with physical activity, walking, lifting, running, jumping, laughing, sneezing, etc. Fixincontinence.com is a great resource for male incontinence. I also wanted to mention that, but male stress urinary incontinence is very common. We think that worldwide 13 million men may suffer from SUI or stress urinary incontinence, and annually in the United States, 17,000 men every year develop bothersome stress incontinence. We all pretty much know how the urinary process works, but I would draw your attention to not just the bladder, and we pass the urine through the prostate, but there's what's labeled as a sphincter is the external urethral sphincter, which lays right next to the prostate, surrounds the urethra. And so when we remove the prostate for prostate cancer, we spare that sphincter. That sphincter stays there, but without the prostate there, that sphincter has to learn to work harder and become stronger and during a rehab process. And sometimes that sphincter just is not quite strong enough to do all the work. And so that can lead to male stress incontinence. So the sphincter is very important when we talk about the different treatment options. Certainly there can be other causes for stress incontinence in a man, surgery for a very large prostate, different neurological conditions, but by far and away the most common cause of stress incontinence is removal of the prostate for prostate cancer. Huge effect on quality of life for men. Having to wear pads, worried about the smell of urine, worried about leakage of urine, also the cost long term of using pads and undergarments, and really just the mental health toll that this takes on a man. They oftentimes get through their prostate cancer treatment. They're doing very well with an undetectable PSA, but they're left with using pads or wearing pull-ups and dealing with erectile dysfunction issues. And so it can lead to a very high rate of mental health issues, depression, anxiety, a loss of confidence. Now, I'd like to move on to treatment this is the link between stress incontinence and prostate cancer treatment. About 90,000 men have radical prostatectomies every year in America, and approximately 1 in 10, do have some persistent leakage issues that require treatment. Usually that first 1 or 2 years after prostate removal, men are getting better, and we oftentimes have them go through pelvic floor exercises to strengthen that sphincter muscle, but there's still some rate of stress incontinence. This just diagrams removal of the prostate, and where we after the prostate's removed, we put the urethra back to the bladder over a catheter, but spare that external urethral sphincter. And once that catheter comes out, we really ask that sphincter muscle to work a lot harder. Moving on to different treatment options for both ED and stress incontinence. We're going to go through everything. And again, if you have questions, please leave those in the chat so we can get to them at the end of the talk. It's any physician or nurse practitioner or PA can treat erectile dysfunction. It's, you know, you can go online now and get pills. You can see your primary care doctor and get pills. You can get treatments from your primary care for sure. But a urologist is the expert in erectile dysfunction. Even with most urologists don't do what I do, which is specialize in erectile dysfunction treatment and offer long-term solutions. And so it's important to see a specialist if you are having trouble beyond some of these first-line treatments we talk about. The first treatment for ED, it involves oral medications, otherwise known as PDE5 inhibitors. These are known by the names of Viagra or Cialis. They've all gone generic now and go by the names of sildenafil for generic Viagra, tadalafil for generic Cialis. They all work in a similar fashion by increasing blood flow, by dilating blood vessels, and they have to be taken. They don't work instantly. They have to be taken at least 30 to 60 minutes prior to activity, and they can be associated with some side effects because of increases blood flow, not just to your penis, but all over the body. So you can have some headache, backache, facial flushing, uh, GI, like indigestion kind of side effects. Also, some visual disturbances can be associated with these pills. And again, here at the bottom, you can see that in a study of nearly 20,000 men, men with diabetes were 1.5 to 2 times more likely to move on to other treatments. I'd also say that men with Peyronie's disease have earlier failure of these medications, but these medications are commonly prescribed and thankfully are a lot cheaper than they used to be. Over time, those oral medications become less effective, and the next treatment option that's available are injections. This is actually a needle where you have to stop, go to the refrigerator, draw up a syringe of medication. That we typically have to use a compounding pharmacy to prepare what's called trimix. So it has a mixture of chemicals that you actually inject into the side of the penis to deliver the medicine right to those corpora. It does take about 10 to 20 minutes to set up. You have to be sure to not use too much to avoid what's called priapism, which is a prolonged painful erection that requires emergency treatment. So it does have the side effects of having to put a needle in, pain, bruising, sometimes some scar tissue that can develop where you're putting the needle in over and over again. That scar tissue can lead to some curvature, and I've seen Peyronie's develop after use of injections. To be honest, a lot of my patients just don't want to put a needle in their penis, and so it's kind of somewhat cumbersome, requires some preparation in advance. The medication has to be refrigerated, so if you're out and about and have a nice dinner and you're not by the refrigerator, your injections are not the best option for you. It also is not really covered by insurance plans, and so you're buying out-of-pocket compounded medications for an increased cost. The other option that you can buy on Amazon is a vacuum erection device, or VED, and that's to be honest, I've never met a man happy long term with a vacuum erection device. We sometimes use it in concert with injections or for penile rehab after prostate cancer removal, just to increase blood flow to the penis because you're using vacuum to pull blood in. We're using a vacuum tube, and then you have to slide a constriction ring around the base to try to hold the blood in there. It is a cold, more floppy erection. It's not really as hard as most men would like. You do have issues with oftentimes blocked ejaculation and some pain or cumbersome nature of trying to get that seal at the base of the penis. When those medications are either not effective or not tolerable, a long-term solution for men suffering from erectile dysfunction is a penile implant. This is the only treatment that allows a man to have the confidence that to have the spontaneity and the durability and the reliability that when he wants the erection, he knows he's going to be able to get an erection. This is an actual a three-piece penile implant you could see in this diagram that has completely inserted beneath the skin. It has a pump in the scrotum. It has two cylinders that run down the shaft of the penis that fill up those corpora cavernosa. And then it has a reservoir of salt water beneath the patient's six-pack. And when the patient wants to have an erection, he pushes on the scrotum and he transfers that water to the penis, and it gets hard on demand. So it's completely concealable. It's very discreet. No one knows that you have it unless you tell them. You can see nothing from the outside, and it allows for complete control of the erection whenever the patient is ready. Very high patient satisfaction rates, 98% patient satisfaction rate with a penile implant. This is a little another diagram here. It is this is the AMS 700 three-piece inflatable penile implant. Kind of what I like to call the Cadillac model. It's coated with an antibiotic coating to reduce the risk of infection. It's the most natural feeling erection that you can get, and it is leads to long-term satisfaction rates of well over 95%. Again, a few different models of penile implants that I can go through in your personal consultation, tell you exactly what would fit you the best and what would be your best option. For men that are having manual dexterity issues, there's also malleable options, but by far and away the most common penile implant is an inflatable penile implant. This is a animation here that I'll play that kind of shows how a three-piece inflatable penile implant works. Again, when the implant is not being used, it's totally flaccid, it's soft, and the patient activates the implant by pumping the scrotal pump, and it transfers the salt water to the penis, and it gets hard on demand and stands up and stays hard as long as the patient wants to be hard. When he's done, he hits the deflate button, and the fluid goes back into the reservoir, and the patient can squeeze the penis and accelerate the deflation, and it goes back to being soft, and you can stand in the shower. No one could see anything from the outside. I have another illustration here. If again, this has if you're in a public setting, just be aware this is an actual patient video here that demonstrates an inflation deflation of an actual penile implant in a patient. And you'll actually be able to see the pump in the scrotum. Again, if you're not in a place where you want to watch a graphic video, here's your time to turn it off for a minute. This is an AMS 700 three-piece inflatable penile implant. Again, pumping the scrotum, patient pumps. He's pumping the scrotum and pumping the pump, and it's transferring the salt water to the penis, and it's standing straight up. And we really don't count how many times you pump it. You just pump it. It's not like a tire. You can't overinflate it, but you pump it up to maximum capacity. Stays up as long as you want it up. And again, just like a normal erection. And then when when he's ready to let it down, you'll see it. There's a deflate button. You don't have to hold it down. He pushes the deflate button there on the side, and it starts going down. And you can either walk away or you can squeeze to expedite the deflation process. He's holding the button down longer. It's a momentary squeeze. You do not have to keep holding the deflate down, but it gives the man a full control of the erection, and then he goes back to the flaccid state. So in terms of a penile implant, in my practice, I do over 100 a year. The reason I do so many is patients are my best advertisement. They're generally telling their patients how much they like it. and how much it changed their lives. It's a 30-minute outpatient procedure. It's covered by Medicare and most insurance plans. If you go to someone like me, it's 99% of the time, everything goes very fine. It's a very discreet procedure. You go home the same day, and you generally are off work for about a week. We have to wait about 4 to 6 weeks before showing the patient how to inflate and deflate, but there's one little row of stitches on the top of the scrotum. And that second week, patients generally start getting back into regular activity. And then around that 4 to 6 week mark, you start learning how to use it. And I tell my patients, think of it like physical therapy, especially those that are suffering from Peyronie's disease, like this patient here with this upward curvature, because men who are suffering from Peyronie's, or what we call PD, they're losing that length, losing the girth. The penis isn't working. And instead of, we can't, there are procedures to straighten the penis, but, when we do penile straightening procedures, we're either shortening the penis even more if we're doing a plication, or you run the risk of creating worsening ED if you're trying to excise that plaque and graft it. And so oftentimes the best treatment for Peyronie's that's not responsive to oral medications, you don't want to start putting an additional needle in there to cause more scarring. And so, a 3-piece inflatable penile implant treats both conditions. It treats the ED, and when you put an implant in, you can straighten the penis over that implant, what we call modeling. And although you don't have to be straight as an arrow, it allows the penis to work when you want it to work and doesn't have to have that curve. And it treats both conditions. And as I was saying, you think of it like physical therapy. And so it's stretching from the inside to work against that scarring process and maintain length and girth. I wish I could make a man longer, but it does stop that insidious process of losing length and girth. Once you get an implant, you stop losing that. And so it really does restore. I tell all my patients, think of it as a reconstructive procedure. We're restoring a function that should be there. And again, this drives home the point that a penile implant is a great option for men struggling with ED and Peyronie's. Again, very high patient satisfaction rate. Most of my patients, the common theme that they tell me is that it gives them their confidence back. It gives them that part of their life back. The most common comment I get is, I wish I would have done it sooner. Again, Medicare, haven't had a denial from Medicare in a long time, and most commercial insurances follow Medicare. We can work with you to look at, what your plan, covers, and otherwise it's just whatever you're out at for outpatient surgery. No different than going to the orthopedic surgeon about your knee. Here's one testimonial here from, this is an excerpt from one of the hard video series that you can find at edcure.com. This is Andy here.
It's a general improvement in my whole emotional state. I wish I'd have been quicker about it. My wife about the whole thing is that I didn't get it done sooner. So don't hesitate. It's a general improvement in my.
So again, this is just a summary slide. Very high patient satisfaction rate covered by most insurances. It's it is, patients are coming to me when they're ready for a solution, when they're ready for a repair, a reconstruction, restorative treatment, when they're done using pills, when they're done using shots, and we just like to minimize the frustration. A lot of people just suffer in silence, don't know that these treatments are available. Again, where it says natural, entirely contained inside the body, designed to feel natural during intercourse, doesn't interfere with ejaculation or orgasm. That's a common question. It actually, in my experience, most of my patients say it's actually better because they can focus on the actual erection and not focused on they can focus on the actual ejaculation and not focused on maintaining the erection. That takes that out of the equation for them. And then the patients have the complete control and spontaneity whenever they're ready. As with any surgery, tiny risk of infection or bleeding. It's thankfully infections less than 1%. The only patients that typically have trouble are the ones that don't wait and don't follow the directions. But if you follow the directions, 99% of the time, everything goes very well. And thankfully, mechanical complications are extremely rare. Bottom line, you are not alone. edcure.com has a lot of, good information. You can there's a physician finder. If you're not here locally, you can actually, call, get an appointment with me, and we can sit down and talk about all your options. Wanted to also talk about stress urinary incontinence treatment options. So some men deal with ED and stress incontinence. Some have one or the other, but especially for prostate cancer survivors who are struggling with incontinence, there are behavioral changes, but dehydrating yourself is not going to lead to a long-term solution. Men are going to get tired of using these coping mechanisms of pads and diapers or clamps. Certainly there are these Kegel exercises we mentioned that are pelvic floor strengthening exercises that begin after surgery. But if you're 1 or 2 years out from prostate treatment and you're still using pads, there are very effective treatment options that insurance covers. If you're using less, 1 to 3 pads per day, that's a good indicator that you have very good, voluntary sphincter function, especially if you have not had to have radiation. And just like we've been doing slings for women for leakage after childbirth for years, there's a male sling that's made specifically for men called an Advance XP male sling that I use. I do 20 to 30 of these a year. They're for men who are dealing with a milder degrees of leakage, but it's a 40-minute outpatient procedure where this sling actually acts as a hammock support mechanism to strengthen the patient's own sphincter. It just helps their own anatomy work better and helps augment their sphincter as this hammock support to help get them off the pads, get them back to what they want to do and how they want to do it without being so self-conscious of the leakage. 83%, our patients are pad-free after this procedure. Very high patient satisfaction rate, well over 90% would recommend it to a friend. It's again, a 40-minute outpatient procedure. We can combine the sling with an implant, or we can do it separately. For patients who are using heavier pad usage, more than 3 pads per day, or have had a lot of radiation treatment, have very poor urinary control, the gold standard in incontinence treatment is an artificial urinary sphincter. And so if the patient's sphincter is just not functioning at all, there's an option to actually place a small cuff around the urethra that you can see here. And there's a little control pump in the scrotum. And so this cuff serves to stay closed and keep the patient dry. And when the patient wants to void, he pushes that pump in the scrotum and the cuff opens up and he can pass his urine, and then it can close back off. And so a little more involved, but again, it's still a very standard treatment that can really make a huge improvement in quality of life. This is the AMS 800 artificial urinary sphincter, AUS. It's again, outpatient, a couple small incisions. We have to wait to use the sphincter for 4 to 6 weeks, but it's minimal downtime and it can make a huge improvement in quality of life. So if you're suffering from stress incontinence, I'd encourage you to, along with patients that have ED, to call us and we can get you in for a personal consultation. This is one of the testimonial from a prostate cancer survivor here that received treatment for his incontinence. Again, made it restored his confidence that he can do the things he wanted and not have to worry about the leakage. Again, any surgery is possible risks. Thankfully, a sling, I've never seen one get infected. It's very effective. that sling becomes part of your body, and the next day it's active. The next day, that's the nice thing about a sling is you don't have to wait on activation or wait on it's working the next day. On a sphincter, you have to wait a few weeks to start using it. Again, fixincontinence.com, great resource on looking at your options for stress incontinence. My website, wkymenshealth.com. My phone number is listed there. If you mention that you listen to my webinar, we can get you in without a referral. And I'm going to look at the chat over here and see what kind of questions we have. Again, if you have questions, please type those in now so we can